welcome back to the Golden Canopy Health Management channel. My name is Kevin Lee, and we're dedicated to ensuring health, enriching life, and embracing retirement. Today, we're going to talk about how to choose the right Medicare plan for your needs. It's a very complicated topic, and it's something I feel like you should know and understand the process. So, not only are we going to paint the picture for you, but I also want you to understand how we at Golden Canopy Health Management would navigate that with someone. So the first thing we're going to talk about is step one is understanding your different parts of Medicare, right? Choosing a Medicare plan is like standing in a cereal aisle where there's tons of different options, tons of different flavors. Do you pick a plan with all the bells and whistles? Do you pick something that's simple? Well, all these questions are valid, and we're gonna, go through them so you can understand how the process of picking a Medicare plan makes sense specifically for you, because you have unique needs and we have unique solutions to help you pick the best plan. So step one is to understand your different parts of Medicare. There are 4 parts, and we're talking about Part A, which is your hospital insurance. Of course, that covers your big ticket items. So if you need to go to the ER, so it's inpatient hospital stays, it's nursing care facilities, and some home health care. And if you've worked more than 10 years and you've paid your payroll taxes, your premium for Part A has already been taken care of. So think of it as it's your safety net, is there when you need it the most. Another part of your Medicare is Part B. Part B is for more of your everyday happenings, doctor's visits, outpatient care, preventative service, and that's what your medical insurance Part B is. There is a monthly premium for your Part B, so it's like paying for a gym membership. So don't skip it, because it's essential to stay healthy when you're in your golden years. Another part is Part C, also known as Medicare Advantage. And it's like a combo meal from your favorite health food store. See what I did there? And it covers Parts A and services. It covers the services and coverage of Part A and Part B as well. It also has a few extra bells and whistles like dental, vision, hearing, gym memberships. Plus, it covers some drug prescriptions in Part D as well. So it's an all-in-one plan, Part C Advantage plans. And those are the things we'll be looking for or looking at or keeping into account whenever we dive into the next step, which is a needs assessment or assessing your health needs. Now, everyone's needs are different. So let's talk about what are some of the differences. When someone is sitting in front of me, I give them full license and full authority to be completely selfish about what they want for their health. So some of the questions that come up are, do you visit doctors often? Are you a once a year checkup kind of person, or once a quarter checkup kind of person? Because if you're a once a year checkup kind of person, you're very healthy, you don't need to see a doctor very often. That dictates a different plan than someone who needs to see a doctor every month. So that's something else to keep in mind. Do you travel a lot? Do you take lots of prescribed medications, or are your medicines in your cabinet collecting dust? So a proper needs assessment, a proper assessment of your needs where you are given the license to be completely selfish, is how we would know what the next steps are, how the needle needs to move to talk about what plans works best. The next step we're going to talk about is your budget, right? Because no one wants to blow their retirement on healthcare needs. So we'll take a look at your budget. We'll look at your monthly premiums, your deductibles, your out-of-pocket costs. Some plans might have low premiums, but higher costs when you need care, while others might have higher premiums, but cover most of your expenses up front. It's kind of like deciding whether to buy an all-inclusive resort paid trip, or if you just want the bare minimums and have the option to splurge later on. So that would be considering your budget, and that's how we do that. The fourth step would be comparing your options, right? Which is the fun part, shopping for Medicare. There are tons of tools out there, plan finders, online shopping. You can compare plans side by side, but those two can be a bit confusing. So having someone in your corner from Golden Canopy will sit with you, will put the plans in front of you, and we'll do a side-by-side comparison, because some things are very important to you. Things like, I've had the same doctor for a long time and I want to keep the same doctor, or I'm on prescribed medication and these are medications that I need to be covered. Whatever those things are, we customize a plan and find a plan that fits best for you. And one of our pro tips is don't forget to check any extra perks when picking a plan, because there are lots of extra perks. Medicare Advantage plans throw in things like utilities or shopping in grocery stores. So do make sure that you keep an eye out on those extra benefits as well. Step 5 is don't be afraid to ask for help. Feeling overwhelmed, well, don't worry. You don't have to do this process alone. There are plenty of resources available to you to help, one of which is Golden Canopy Health Mgt. And at Golden Canopy, we offer free, unbiased advice. And we're just a phone call away. The number is 720-927-6891. Give us a call and think of us as your Medicare GPS. We're here to guide you through all the sticky spots of Medicare. And finally is a review annually. Now, just because you're on a plan now, we recommend reviewing your plan every year, because every year your plans change. You may gain some benefits, you may lose some benefits. Life situations change and you might need to drop your current plan and pick a new one. So it's very important for every year during your open enrollment period that you do check what's available. It's like checking your tire pressures for a road trip, and a road trip is to live as long as possible with a proper health management action. So, and that's pretty much all we have for how to pick your plan. Now, choosing the right plan is very important, and it's good to remember that it's all about finding a plan that fits your lifestyle, your budget, and your health. And you need it to fit like a glove, right? So if you find a video helpful, do make sure to share it, like it, subscribe to the Golden Canopy Health Management channel, because we do love putting out more videos for information to help guide you through the Medicare maze. You can reach out to us via phone. The best number is 720-927-6891. You can also check out our website at goldencanopyhealthmgt.com, and you can shoot me an email at kevinlee@goldencanopyhealthmgt.com. Thanks so much for tuning in. Stay healthy, stay safe, and we'll see you next time. Bye-bye.